Bismillahirrahmanirrahim. Today we are going to talk about sympathomimetic drugs or adrenergic agonists. So let's move. Fight or flight. This is the automatic physiological response to an event, to a stressful or a threatening event that is perceived by a person. And perception of threats activates sympathetic nervous system and it trigger an acute reaction that prepare the body fight or flight. So this is the function of sympathetic system. Parasympathetic system control the body function in rest. It is also called rest and digest. Parasympathetic system. Sympathetic system originate from thoracolumbar and parasympathetic system originate from craniosacral or brain and sacral. Sympathetic system has a wide distribution while parasympathetic is limited. The preganglionic fibers of the sympathetic system are short and the postganglionic fibers are long. While that of preganglionic fiber of parasympathetic system is long and postganglionic fibers are short. The effect, the net effect of the sympathetic system is diffused while that of the parasympathetic system is localized. Neurotransmitter in sympathetic nervous system are acetylcholine and norepinephrine, while that of the parasympathetic system is acetylcholine, both preganglionic and postganglionic. You see the pre-ganglionic fibers and the post-ganglionic fibers in the sympathetic and the parasympathetic systems. Its effects on the different receptors. This is the sympathetic nervous system fight or flight effect and different organ. These are the pharmacological action of sympathetic system. Sympathomimetic drugs. So especially the pupil dilatation and heartbeat increase, function of the heart is increased, and dilation as well the stimulation, and similarly stimulation the liver. It has to release insulin and stimulate the release of glucose from the liver. So to cope with the emergency situation. So it causes hyperglycemia. Sympathomimetic drugs are the drugs that partially or completely mimic the action of norepinephrine or epinephrine. These are the drugs which stimulate adrenergic receptor or adrenergic receptors. The synthesis, this is the steps involved in the synthesis of ordinary dopamine. So phenylalanine, tyrosine, dopamine, dopamine. Here are the sites where the adrenergic receptors are located. So alpha 1 receptors are located on the blood vessel. These are there are alpha 1B and alpha 1D receptors. And these are also these alpha 1B and alpha 1D are present on the blood vessel, and the prostatic urethra and eye contain alpha 1A, and the dilated pupil. Alpha 2 receptor are present in the CNS, vasomotor center, and the blood vessel and GIT. Beta 1 receptor present on the heart and the juxtaglomerular cells of the kidney. Beta 2 receptor present in lungs, uterus, GIT, and bladder. Beta 3 receptor present on the body. Classification of sympathomimetic drugs. So we classify it different with three, three ways. So classification based on receptors. These are alpha agonists sympathomimetics. These are alpha 1 agonists like phenylephrine and methoxypine. Alpha 2 agonists clonidine, methyl dopa, guanabans. And alpha beta agonists are adrenaline, noradrenaline, ephedrine, amphetamine. Beta 2 agonists are beta 1 agonists like glutamine. Beta 2 agonists are salbutamol, dobutamine, salmeterol, formoterol. And beta 1, beta 2 non-selective agonists are isoprene. Second classification is based on mechanism of action like direct acting agonist and indirect acting agonist and mixed action agonist. So direct acting agonists are epinephrine, norepinephrine, phenylephrine, salbutamol. Indirect acting agonists are amphetamine, cocaine, tyramine, and ephedrine. Next action agonists are ephedrine and pseudoephedrine. Classification based on chemical structure. So these are catecholamines and non-catecholamines. Catecholamine are those sympathomimetics which have catechol nucleus in their structure. While non-catecholamine are those which are devoid of catechol nucleus. Catechol are the catechol nucleus contain two hydroxyl group at position 3 and 4 of the benzene ring. The drugs included in the catecholamine sympathomimetics are epinephrine, norepinephrine, adrenaline, dopamine, and while they're present in the non-catecholamines are amphetamine, ephedrine, phenylephrine, and salbutamol. Now, direct acting sympathomimetics. So start from epinephrine or adrenaline. Adrenaline is endogenous catecholamine which interact with alpha and beta receptors. At low doses, beta 2 effect, so it causes vasodilation. The vascular system predominates. At low doses, beta 2 effect is predominant. While at high doses, alpha 1 effect is predominant, which is vasoconstriction. Pharmacological action of cardiovascular system. So it strengthens the contractility of the myocardium, which is called positive inotropic effect. So this is due to the beta 1 receptor action. And it increases its rate of contraction, positive chronotropic effect, which is also due to beta 1 action. So both heart rate and contractility increase. That is why it increases the cardiac output, which increases systolic blood pressure. And also the beta 1 receptor present in the kidney, juxtaglomerular cells of the kidney. So it also causes release of renin, which leads to increased angiotensin 2, which is a potent vasoconstrictor and cause high blood pressure. Adrenaline constrict arteriole in the skin, mucous membrane, and viscera, which is alpha 1 effect, and it dilate vessel going to the liver and skeletal muscle, which is due to the beta 2 effect, and it decrease cholesterol blood pressure. On large doses, adrenaline increase cardiac output and peripheral resistance, alpha 1 effect. So it increase in systolic blood pressure and diastolic blood pressure. Male vasomotor reversal phenomenon. So if intravenous injection of adrenaline is given, it causes increase in blood pressure due to alpha 1 effect, followed by prolonged fall due to beta 2 effect. But if if it is administered after giving alpha blocker like phenoxypyramine, phenoxybenzamine. So only fall in blood pressure is seen because the alpha effect is blocked by phenoxybenzamine. So only the beta 2 effect is dominant, which is the dilatation of the vessels due to beta 2 effect. So beta 2 is unopposed and it causes hypertension. This phenomenon is called as vasoreversal phenomena of death. Effect on respiratory system. It is a powerful, adrenaline is a powerful bronchodilator, and it act directly on bronchial smooth muscles beta 2 action. So it causes bronchodilation. It causes hyperglycemia. Significant hyperglycemia effect is caused by increased glycogenolysis in the liver. This is beta 2 effect. Increased release of glucagon, which is beta 2 effect, and decreased release of insulin, which is alpha 2 effect. Lipolysis. Agonist activity on beta 3 receptors and adipose tissue translipolysis. GIT. Adrenaline decreased GI movement, uh, which is due to alpha 2 action. Alpha 2 stimulation on the adrenergic nerve terminals cause the decrease or inhibit the release of acetylcholine. So it causes decreased movement of the GI. It constricts the sphincters, which is due to alpha 1 stimulation. Next is the urinary tract. Urinary tract does relaxation of the bladder wall due to beta 2 effect. And it contracts the sphincter, which is due to alpha 1 stimulation. Genital tract. Adrenaline causes ejaculation of semen due to contraction of the smooth muscles in the seminal vesicle and the vas deferens and the prostatic urethra, which is effect due to alpha 1 stimulation. In eye, dilatation of pupil occurs due to contraction of dilator pupillae, which is due to alpha 1 stimulation. In liver, it causes hyperglycemia. Kidney increases release of renin, which increases angiotensin 2, and potent vasoconstrictor and increase the blood pressure. It's effective due to the beta 1 receptor apparatus of the kidney. Pancreas, the adrenaline stimulate beta 2, which increase insulin release. Stimulation alpha 2, it decrease the insulin release. Pharmacokinetics of the adrenaline. Epinephrine has a rapid onset of action and brief duration of action due to its rapid degradation. Oral administration is ineffective because epinephrine and other catecholamines are inactivated by intestinal enzymes. It is metabolized by monoamine oxidase and catabolotransferase enzyme. It is excreted in urine. Therapeutic uses, it is used in anaphylactic shock, bronchospasm or bronchial asthma, cardiac arrest. With local anesthetic, it is used to increase the degradation of local anesthesia. To control epistaxis. So very weak solution of adrenaline is topically used as vasoconstrictor agent in the mucous membrane of the epistaxis. It is also used in urticaria and angioedema. Adverse effects. CNS disturbances like anxiety, fear, tension, headache, and tremors. Hemorrhage, cerebral hemorrhage, marked elevation of blood pressure. Cardiac arrhythmias, trigger cardiac arrhythmias, particularly patient is receiving digoxin. Pulmonary edema can induce pulmonary edema. Contraindication of adrenaline. Hyperthyroidism. Epinephrine enhances cardiovascular action in hyperthyroidism. Dose of epinephrine must be reduced in such condition. Increased production and upregulation of alpha receptor in the musculature and beta receptor in the hyperthyroid individual lead to hypersensitivity responses. Second one is diabetes. Epinephrine increase the release of endogenous stores of glucose. In diabetic, dosages of insulin may have to be increased if someone is on insulin. Cocaine, cocaine plus epinephrine, if it is given combined, exaggerated cardiovascular action because cocaine prevents reuptake of catecholamine into the adrenergic neuron. Beta blocker. Uh, Beta blocker prevent epinephrine effect on beta receptor, leaving a receptor stimulation unopposed and increase in peripheral resistance and increase in inflammation. So should be avoided. Inhalation anesthetics. Halothane-like agents sensitize the heart to the effect of epinephrine, which may lead to tachycardia. Next drug is norepinephrine or noradrenaline. Noradrenaline, this is also endogenous catecholamine, and which is uh, agonist at alpha 1, alpha 2, and beta 1 receptor, similar potency as epinephrine. And it has no effect or little effect on beta 2 receptors. Increased peripheral resistance, alpha 1, and both diastolic and systolic blood pressure, beta 1 stimulation. Compensatory barrel reflex activation tend to overcome the direct positive effect of the norepinephrine in vagus nerve. However, the positive inotropic effect on the heart are maintained. It is inotropic effect is decreased, but the due to vagus stimulation. Receptor stimulation cause send information to the brain from where the vagus nerve is stimulated and vagus nerve cause decrease heart rate. So the chronotropic effect is decreased while the inotropic effect is increased. The force of contraction is increased when the heart rate is bradycardia, reflex bradycardia. Therapeutic uses carefully used to treat cardiogenic shock or dopamine is preferred as norepinephrine is associated with the renal shutdown, and dopamine is preferable as it causes increase the renal perfusion in shock. Adverse effects are excessive doses can cause severe hypertension and not suitable for supporting undiluted IV injection due to danger of necrosis. Next drug is dopamine. Dopamine is also a category catecholamine, endogenous catecholamine, and it is like norepinephrine. Important feature of dopamine is its dose-dependent action, which is 2 to 5 microgram per kg per minute. Activate D1 receptors, which causes renal vasodilation. 5 to 10 microgram per kg per minute. It activate beta 1 receptors and it causes increase cardiac output. And more than 10 microgram per kg per minute activate alpha 1 receptor, which causes vasoconstriction and increase in blood pressure. Dopamine deficiency in basal ganglia leads to Parkinson's disease, which is treated with its precursor dopa. Dopamine antagonists are antipsychotic drugs. Therapeutic use it is used in condition with low cardiac output with compromised renal function. So it is the drug of choice in cardiogenic shock with compromised renal function. IV infusion regulated by monitoring of the pressure and rate of the coverage. That's enough for today.